So in clinical feature of an abrasion, this abrasion is normally caused by the toothbrushing. So toothbrush abrasion is more common, occurring cervically, because the brush is more, friction of the brush is more on the cervical area. So that is why you will get the cavity at the cervical area. Usually occurs on the exposed root surface of the teeth and sometimes incisal and occlusal surface. Why it's on the exposed surface of the root? Because if you see the exposed surface, it's normally where it will be at the C junction. So if it is at C junction, then the thickness of the cementum is very thin. You know the type of D junction, cemento-enamel junction, right? It's either it is a gap junction, H2H junction, or it is a overlapping junction. Overlapping will have a less number of cavity, but if you see the gap junction will have a more number of cavity at the cervical junction. Abrasion caused by the dentrifices appears as a V-shaped wedge or a wedge-shaped ditch on the root side of the CEJ. So these are the dentrifices, because you are using the powders for the brushing or a paste for the brushing. So whatever paste you are using, what are the dentrifices are there, what are the abrasive particles are there in the paste, that causes the abrasion on the tooth. Then enamel, then abrasion more common on the left side of the mouth in the right-handed persons. So it's very common that when the person is right-handed, it will give more pressure on the left side of the teeth, and if it is left-handed person, will give more pressure on the right side of the tooth. And canines and premolars are the most commonly affected and exhibit sharp margins. So when the cut is there, that will exhibit as a sharp margin. So that is the characteristic feature of that wedge, the mechanical trauma. It shows a mechanical trauma. So you can make out here at the cervical junction, just below the enamel where it ends. So that is why you will have this V-shaped notch. You can make out this V-shaped notch. Yeah, maybe saucer shape also, but you can make out this typically with the help of, it's typically as a wedge-shaped cavity at the cervical area. And this might be a right-handed person, so that is why there is a more cavity on the left side of the teeth. Why it is on the canine or premolar? Because the maximum pressure area bears in the corner of the teeth. So the corner of the teeth, either canine or the premolar, bears the more pressures of the brushing. So that is why you will have a wedge shape starting. The initial cavity will be at the premolar area. It starts from premolar and it goes further ahead on the molar area here. You can make out this proper brushing here. This is how the brush normally moves in between the teeth and the gums. So because of this bristle here, they causing the cavity like this at the CE junction. And because of that also, the gingival line or the gingiva at gingival edge will also move further down and leading to exposure of the more amount of cementum. So once the more amount of cementum will be exposed, so that is why there will be more chances of having deep cavity in these areas. You can make out here proper wedge-shaped cavity, V-shaped cavity here. So now what are the brush? Which type of brush you are using? Normally, is it a soft brush, it is a medium brush, or whether it is a hard brush? The cavity depends on that. If it is hard brush, definitely the cavity will be more on that area. If it is soft or medium, it will be less prone to give this kind of a cavity. Paste. So which kind of paste you thought? That yes, paste is also responsible for the abrasion cavities like this. So whatever the content of the paste, the abrasive content in the paste leads to this kind of a cavity. So which kind of a paste will have more of an abrasive cavity? So whichever paste you know, among those, if you see this paste, see in this paste, what are the abrasive? See why they are using abrasive in the paste? Because if you want to polish something, you need to brush like this with the sandpaper. If you want to metal wood polish, what you will do? You will brush with the sandpaper. And the course of the grains here, you can make out this grain size. If it is smaller, it will be finishing. If it is larger like this, it will give more cutting. So that is also depend upon the what courses of granules is used in the paste. So that decides the amount of cavity or the fastness of the cavity, how fast it will appear. So normally which paste commonly used are the Pepsodent, Colgate, Close-Up and Sensodyne. So Among these, if you see which paste uses more amount of dentrifices and which paste can lead to more amount of this kind of a cavity, which is called an abrasive cavity. So what do you think? Which paste should be supposed to be used? If patient comes to you, which paste you will suggest? Whether Pepsodent, Colgate, Close-Up and Sensodyne. Sensodyne is which kind of a paste? It's a anti-sensitivity paste. Correct? Close-Up, what they claim? Brightness, whiteness they are claiming. Colgate, okay, they are claiming just an cleaning of the teeth. Even Pepsodent also claiming the gum care. Right? See the tagline. Why this tagline is like this? Because taglines normally suggest what is in it or what function they are doing. So if you see here, see the abrasive index. Pepsodent, how much? It's 26% only abrasive index is there. So that is why they are giving gum care. If the abrasive is more, then definitely more friction will be there. So the gum may go down. Colgate, what they are giving? It's an average, anti-cavity. So they are using it 51% of an abrasive index. Close-Up, whitening. So they are using 87% whitening. If you rub the surface, definitely it will be polished surface. And because of the polishing of the enamel, it will appear to be white. No stains will be there on the surface of the tooth. So that is why Close-Up claiming of an white tooth. Right? Then Sensodyne, what they are claiming? They are claiming of an anti-sensitivity. So how the anti-sensitivity will depend upon the abrasive index of an, and the content of the abrasive. See the 157 abrasive index. It's so high, it's double of an Colgate. Maybe 3-4 times of an Pepsodent. So why this is happening here? Because Sensodyne, what the abrasive index normally, what the abrasive particle do in sensitivity? Yes, they open the tubule first and then they allow to block the tubule with the calcium formation or maybe natural closure of the odontoblastic process. Once the odontoblastic process get closed, then only there will be formation of a chances of formation of a secondary dentin. Right? If the enamel surface will get wear off, the secondary dentin will form below. So once the secondary dentin will form, so the chances of sensitivity will be reduced in that case. So that is why they are using more abrasive in the claiming as a sensitivity paste. Okay, so now you understand which kind of a paste is supposed to suggest. It's depending on what is the patient's complaint. Patient number white teeth, advise Close-Up. Normal brushing, Pepsodent and Colgate. Sensodyne, but this is most common side effect of Sensodyne, that a tooth will get abraded. Once it gets abraded, then definitely sensitivity will be automatically reduced. Right? Then pathogenesis similar to the abrasion. So it's supposed to be same: exposure of the dentin and tubule, irritation of the odontoblastic process, secondary dentin formation, pulpal to the primary dentin, and protect pulp from the further injury. So once the secondary dentin form, it will be get protected from the further injury. So what kind of a treatment you will suggest if these patients are there? Yes, these patients are there. What treatment you will suggest? You will do a filling there? Yes, you can do a filling over here, but the only thing is the pulp chamber are very close at the cervical junction. If you see here, if you measure here, there will be more distance from here to pulp chamber, right? From here to the pulp chamber. But if you see here, this point, the pulp chamber is very close. So which kind of cement that you are using to fill this cavity is also important. And anti-expansion, anti-erosion is that less expansion cement is supposed to be used, less irritant cement is supposed to be used to fill this kind of cavity. Okay, if it is so deep that the pulp chambers are open, that time you have to go for the root canal treatment and then filling of the tooth. The third one is erosion. So what is erosion? Erosion is a wearing or loss of tooth surface by chemico-mechanical action. Chemico and mechanical. So the chemical supposed to be there, the chemical action supposed to be there in the erosion form. It is irreversible loss of dental hard tissue that does not involve bacteria. So it's irreversible damage to the tooth. The dissolution of the mineralized surface structure occurs upon contact with the acid that are introduced in the oral cavity from intrinsic or extrinsic sources. So what are intrinsic sources? Gastroesophageal refluxes, vomiting coming from the inside. And extrinsic surfaces, what you are taking from the mouth, that is the acid touching to your tooth during eating, drinking, like acidic beverages, citrus fruit or any lemon, any citrus fruit if you are eating, definitely they are containing acids in it. So if you see here, this is what, see the erosion on the surface. You will see the shine. See how it differentiates from the abrasion. You can differentiate it from the abrasion on the basis of the shiny surface present on this occlusal surface of the teeth. They are very shiny. In abrasion, it will not be as shiny. Okay, the reflection of the light will be less in the abrasion, but more in the erosion, because it's a chemically each tooth. Okay, so that is why the reflection of the light will be more in these cases. So that is why, see, again, which kind of an intrinsic or extrinsic factor is responsible here? Here you can make out the intrinsic factor because outer surface is normal. Here, see the outer surface. The outer surface is affected. So that is why this is here you can make out the extrinsic factors are responsible in this kind of an erosion cavity. So extrinsic factor comes up to dietary acidic, citrus fruit, fruit juice, carbonated drinks, then other factors which are also responsible. Environmental erosion, wine testing, metal planting, battery manufacturer. I told you that in initial lecture, initial part of the lecture, that wine testing also they have to drink little bit of wine to test whether the wine is good or not. So it may be a more acidic. So that is why they have more chances of having erosions on their teeth. Metal planting, the environment, the atmosphere surrounding those people are with metal particles. Then chemical particles are also there. Battery manufacturing, yes, chemicals are there in the surrounding. Then intrinsic factor, these are the disorders normally responsible, the gastric disorders, the GI ulcers, then chronic alcoholism, chronic excessive vomiting. So these are the factors which are responsible for the intrinsic factor responsible for the erosion cavity. Then eating disorder, it will not be a disorder, but yes, because of lots of eating, acidity will be there, nausea will be there. Then in diabetes mellitus also you will have some kind of an acidity. Pregnancy also shows in initial trimester, they shows acidity, more of an acidity and gastric change in the gastric reflexes. So the vomiting is more, so that is why the gastric juice comes out and touches to your teeth, causing erosion cavity. So if you see the beverages which you are taking, see the maximum. This is what is a pH. What is normal pH? 7. It's considered to be neutral. Alkaline, more than 7. Acidic, less than 7. So see the Coca-Cola where it stands, 0 to 2, in between 0 to 2. How much it comes here? See 2.63. Diet Coke, 2.46. See the 7-Up, 3.2. So Coke, 3.22. Sprite. See, what is the pH? They are so acidic. If you take this kind of an acid on your tooth surface, definitely enamel is going to wear off. And if you take alkaline, tap water, ionized water, which comes up to the 8 and 9. So the mineral water, this consists of an alkaline consistency. So that is why you have to decide what kind of a drink you are supposed to take. Next is an AFfraction. What is AFfraction? It's a pathologically loss of the tooth substance caused by the biomechanical loading forces that result in flexure and failure of enamel and dentin at the location away from the loading area. That means what? That means, now see here, I can make out, you will make out here. See, you can see the fracture somewhere here. Yes, there is a fracture. But is the occlusion is correct here? No, because normally it generates from the traumatic occlusion or maybe traumatogenic occlusion. So what is you supposed to know before that? What is traumatic occlusion then? The occlusion which is you consider as a malocclusion which leads to the trauma from occlusion. That means your intercuspation is not proper, your overjet overbite is not proper, and that leads some kind of a trauma to your teeth. So that is why the trauma will lead to the location away from the loading area. That means here they are touching, but the trauma will somewhere else.